Hey everyone, and welcome to another deep dive.
Hey.
Today, we're diving into something that I think a lot of you can relate to, and that's myopia and LASIK surgery.
Right.
To help us understand all of this, we've consulted with Professor Dr. Suhail Sarwar. He's a leading eye surgeon over in Lahore, Pakistan.
Yeah.
And he's really doing some incredible work with a procedure called Femtosecond, which is helping people ditch their glasses for good. Pretty amazing stuff.
It's exciting stuff.
So before we jump into all the details about LASIK, can you give us a super quick rundown on myopia?
Sure.
What is it exactly, and why do some of us need glasses or contacts just to see clearly?
So basically think of your eye like a camera.
Okay.
The cornea and the lens at the front, those act like the camera lens, right?
Right.
And they focus the light onto the retina at the back, so that's like the film.
Okay.
Now in myopia, that light focuses in front of the retina instead of right on it. It's like you're trying to take a picture, but your lens is set to the wrong focus. So anything that's far away is going to look blurry.
I got it. Okay, so it really is all about where the light lands in the eye.
Exactly.
Now, what causes this focusing problem, in the first place?
Well, genetics are definitely a part of it.
Mm-hmm.
If your parents have myopia, chances are you're more likely to develop it too.
Right.
But it's not all about genes. It's also our environment and our habits that play a role.
So me spending hours staring at screens like I did growing up, that could have actually impacted my vision.
Yeah, there's really strong evidence that suggests that prolonged near work, like reading, using computers, phones, all that stuff really contributes to myopia development.
Yeah, sure.
It's like, your eye muscles, they kind of get stuck in that close-up focus mode.
Okay. So besides blurry distance vision, are there any other signs of myopia that we can look out for?
You might get headaches, especially after you've been reading or using the computer for a while.
Right.
Eye strain is another common symptom. Squinting. Basically, if your eyes feel tired and strained, it's definitely worth getting checked out.
Yeah, for sure. Now, we've talked about glasses and contacts being those traditional solutions for myopia, but let's get into what's really got everyone talking, and that's LASIK. How does LASIK actually work to fix this focusing problem?
So LASIK, or laser-assisted in situ keratomileusis.
Catchy.
It's a surgical procedure that uses a laser to reshape the cornea.
Okay.
That's that clear front part of your eye. It's like we're fine-tuning that camera lens to get a crystal clear picture. So by altering that cornea's curvature, we're redirecting that light so it focuses correctly on the retina.
Okay.
And that improves your distance vision.
Got it. So instead of needing glasses or contacts to adjust the light, LASIK is actually changing the shape of the eye itself.
Yeah.
That's pretty amazing.
Yeah. And with advancements like FemtoLASIK, these procedures are much more precise and safe.
Right. Now, I've heard that term FemtoLASIK thrown around a lot. What makes it different from traditional LASIK?
So the big difference is the type of laser we use. FemtoLASIK uses a femtosecond laser. That emits incredibly short, precise pulses of light.
Wow.
So surgeons can create the corneal flap, that's the thin layer of tissue they lift to access the cornea for reshaping, with way more accuracy and less trauma to the eye.
So it's like using a really high-tech, super precise scalpel instead of the traditional blade. Is that why Professor Dr. Sarwar, our surgeon we talked about earlier, favors this technique?
Yeah, exactly. It leads to faster healing, less discomfort, and potentially fewer complications. It's the gold standard for many surgeons these days.
I see, that makes sense. Now, I know there are other types of refractive surgeries out there besides LASIK, like PRK and SMILE. Where do those fit in?
That's a great question. It's important to remember LASIK isn't a one-size-fits-all thing.
Right.
Each procedure has its strengths and weaknesses, and the best choice depends on your individual needs and your eye characteristics.
So it's not just like choosing Coke or Pepsi. It's more like figuring out what recipe works with your specific ingredients.
Yeah, you got it. So PRK, that stands for photorefractive keratectomy. It's a surface treatment where the laser is applied directly to the outer layer of the cornea. It doesn't involve creating a corneal flap like LASIK, so it might be better for some people with thinner corneas or for people in jobs where that corneal flap could be risky.
So it's kind of like sanding down a piece of wood instead of carving into it.
Yeah, that's a good analogy. The trade-off is that PRK usually takes longer to recover and can be a bit more uncomfortable at first. Then there's SMILE, or small incision lenticule extraction. It's the newest one.
Okay.
And it uses a femtosecond laser to create a tiny lens-shaped piece of corneal tissue, we call it a lenticule, within the cornea. Then that lenticule is removed through a small incision,
Okay.
and that reshapes the cornea and corrects your vision.
Oh, wow. So it's like a minimally invasive sculpting technique, almost shaping the cornea from the inside out.
Exactly.
Why would someone choose Smile over LASIK or PRK?
Smile is really appealing to folks worried about dry eyes because it impacts the corneal nerves less. It also has a quick visual recovery and lower risk of some complications.
Sounds like Smile could be a real game changer for certain people.
Yeah.
But it seems like choosing the right refractive surgery is a super personalized decision.
It is. And that's where seeing a qualified eye surgeon is so important.
Right.
They can look at your eyes, talk about your lifestyle, and help you weigh those pros and cons to find the right fit for you.
So it's really not about what procedure is best overall, but what's best for your needs.
Exactly. So it's important to do your research, ask questions, and choose a surgeon you trust.
Makes sense. Before we wrap up this part of our deep dive, can you tell us a bit more about the results that people can expect after a LASIK or these other procedures? Can they really ditch those glasses and get that 20/20 vision?
It's the question everyone wants to know. And the good news is that these procedures are very successful. Studies have shown that a very high percentage of patients get 20/20 or better after ASIK, but like any medical procedure, results can vary.
Right. So even with the best technology and surgeon, there are no guarantees.
That's right. Factors like how severe your myopia is, how thick your cornea is, the shape, even your age can all play a role.
Makes sense. It's science, not magic.
Right.
But even if someone doesn't hit perfect 20/20 vision, they're usually getting a good improvement, right?
For sure. Many people find that they need their glasses or contacts way less, and that their vision's clearer than ever before.
That's great. This is all so fascinating. I feel like I'm really getting a clearer picture myself about refractive surgery.
Yeah, it's a remarkable field, always evolving with new technologies and techniques to help people achieve the best vision possible.
It's amazing. We've covered a lot of ground already in this first part of our deep dive, but I'm excited to go even deeper into the world of LASIK. We'll look at potential complications, advancements, and even hear from people who've gone through the procedure.
Yeah, that'll be great.
Stay tuned.
Welcome back. Ready to explore LASIK a little deeper?
Yeah, definitely. We talked about how precise these lasers are, but I'm wondering, how do surgeons make sure that the laser is reshaping the cornea the right way and that the eye can even handle these changes? It just seems like there's a lot that could go wrong.
It's a good question, and you're right. The cornea's structural integrity is super important. That's where corneal biomechanics come in. It's basically looking at the cornea's strength and stability, making sure that it can actually keep its shape after we reshape it.
Oh, I see. So it's not just about zapping the cornea with a laser. It's understanding how it'll respond and making sure it's strong enough to handle the change.
Exactly. Think of it like renovating a house. You wouldn't just start knocking down walls without checking the foundation, right? Right.
The cornea is like the foundation of your vision, and we got to make sure it's solid. Makes sense. So before even thinking about LASIK, surgeons really check the cornea to make sure it's safe.
Absolutely. We use all these fancy imaging techniques and measurements to assess the thickness, the curvature, the overall strength. It helps us decide if LASIK is even a good idea, and if it is, we create a personalized treatment plan that, minimizes the risks.
So it's like a tailor taking measurements for a suit. You want the perfect fit. But even with all these precautions, I'm guessing there are still some things that could go wrong. What are some complications, and how are they managed?
Yeah, you're right. No surgery is 100% risk-free. With LASIK, most side effects are temporary and manageable. Dry eyes are pretty common, but usually get better with eye drops. Some people see halos or glare, especially at night, but those usually fade over time.
And what about that corneal ectasia we talked about before?
Right. So corneal ectasia is when the cornea weakens and bulges out. It can happen after LASIK. It's really rare, though, and that's why we're so careful with screening beforehand. If the cornea is too thin or weak, then LASIK might not be the right option.
Got it. So you're basically making sure the tree branch is strong enough before you climb on it.
Haha, exactly. Thankfully, LASIK technology has come a long way. That's helped reduce the risk of ectasia, too. Like there's LASIK Extra, which combines LASIK with something called corneal collagen cross-linking.
LASIK Extra. That sounds pretty intense. What is that?
It's actually pretty simple. After the cornea is reshaped, we put in riboflavin eye drops and use UV light to strengthen those collagen fibers in the cornea. You're basically making it more stable.
So it's like adding rebar to concrete to make it stronger. Sounds like they're going all out to make this as safe as possible.
That's the goal. We want to give our patients the best results, and safety comes first.
Now, speaking of outcomes, we talked about those studies showing how well LASIK works. What were some of the key findings?
Well, one study focused on patients who had LASIK from myopia when they were younger and then later developed cataracts.
Right, cataracts are common as you get older.
Exactly.
So what did they do for those patients?
Well, during cataract surgery, the clouded lens is replaced with an artificial lens called an intraocular lens. And instead of just using a standard lens that only corrects distance vision, they can put in a trifocal lens that corrects for near and intermediate vision too.
Oh, wow. So they're fixing two problems at once, the cataracts and needing reading glasses.
Exactly. And the study showed that the patients who got those trifocal lenses had much better near vision. They could read and do close-up tasks much easier without needing glasses.
That's awesome. Sounds like trifocal lenses are a game changer, especially if you want clear vision at any distance. Was there any other research that stood out to you?
Yeah, another study compared different types of excimer lasers used in LASIK, specifically the ML90 and the Schwindamaris 750S. Those are both really advanced lasers, super fast, and they found that both lasers had similar results in terms of clarity and predictability.
So it's not just about having the latest laser, it's about using the right tool for the job and having a skilled surgeon.
You got it. Technology is super important, but the surgeon's skill and experience matter just as much.
This reminds me of what we talked about before, about how personalized treatment is so important in refractive surgery.
Right. Just like a good chef uses different ingredients and techniques depending on the dish, a skilled surgeon will customize the LASIK procedure to you.
Okay, now I'm craving a gourmet meal and perfect vision. But before we go off on food tangents, I'm really curious about the actual LASIK surgery experience. What can people expect?
Yeah, it's normal to feel a little nervous about eye surgery, so let's break it down. Before the procedure, you'll get a really thorough eye exam. We'll measure your corneal thickness, map the shape of your cornea, check your pupil size, all of that.
So you're making sure everything's good to go before you start, like a checkup before a big trip.
Exactly. On surgery day, you'll get some meds to help you relax. Then we'll use numbing eye drops so you don't feel any pain.
That's good to hear.
Yeah.
Not a fan of needles and pain.
Don't worry, LASIK is painless. You'll be awake during the procedure, but we'll hold your eye open with a little speculum, and you'll just focus on a target light.
So I'm lying there, eyes numb, staring at a light.
Yeah.
Then what?
Then the laser comes in. First, it creates the corneal flap, and then it reshapes the cornea underneath based on your treatment plan. The whole thing usually takes less than 15 minutes per eye.
Wow, that's quick.
Technology is amazing. After, you'll get protective eye shields to wear for a few days, and you can go home and rest. You might have a little discomfort, like grittiness or blurry vision at first, but it gets better fast.
What's the recovery time like? When can people get back to their normal life?
Most people see a big difference in their vision within the first 24 hours. You can usually go back to work or school in a day or two. But it's important to avoid strenuous stuff, swimming, and eye makeup for a few weeks while your eyes heal.
So it's not a super long recovery, but you still need to take it easy and follow the doctor's orders.
Right. It's also important to go to all your follow-up appointments. That way we can make sure everything's healing right and answer any questions.
It's like getting a new car. You want to keep up with the maintenance to keep it running smoothly?
Good analogy. But besides the physical recovery, there's a big psychological impact too, right? People are seeing the world differently after LASIK.
Yeah, it must be so freeing to wake up and see clearly without needing glasses or contacts.
It is. People say they feel more confident, independent, and free to do things they might have avoided before. But there can be some psychological challenges too, of course. Some people get anxious before the surgery, and others might have unrealistic expectations.
So managing those expectations and talking openly with your surgeon is important for a good experience.
Couldn't agree more. A good surgeon will listen to your concerns, set realistic expectations, and support you. It's about more than just fixing your vision. It's about helping you live your best life.
I love that. We've talked a lot about the benefits and recovery, but what about the long term? How long do the results of LASIK usually last?
That's a common question. LASIK is considered a long-lasting solution, but your eyes are constantly changing throughout your life.
So it's like anything else in life, there's no permanent fix.
Well, it's not quite that simple, but you get the idea. Most people have great vision after LASIK, but some people might see their myopia come back a bit over time.
So even though the laser changes the cornea, your eyes can still change as you get older.
Exactly. While LASIK can't stop natural aging, it can often slow down how fast myopia progresses.
So it might not completely prevent age-related changes, but it can buy you some time. What if someone's vision does change later on? What are their options?
Sometimes we might recommend a LASIK enhancement. That involves lifting the original corneal flap and using the laser again to fine-tune the correction. It's like a tune-up for your vision.
Good to know. So even if your vision changes a little over time, you can still maintain those LASIK benefits.
Exactly. Plus, laser technology is always improving, making those enhancements even safer and more precise.
This talk about the long-term effects of LASIK has been so helpful. It really shows how important it is to make an informed decision, have realistic expectations, and have a good relationship with your eye doctor.
For sure. LASIK is a big decision, and it's important to think it through carefully, understand the benefits and risks.
Okay, we've covered so much in this deep dive. We've learned about myopia, looked at LASIK and other surgeries, and even talked about how vision correction affects people. But there's still one big question. Is LASIK right for you? In the final part of our deep dive, we'll tackle that head-on, talking about the key things to consider when making this decision. Welcome back to the deep dive. We've talked about myopia, LASIK, and other vision correction options. The big question is LASIK right for you?
That's the question, isn't it? And there's no easy answer. It's really personal, and there are so many things to think about.
So let's break it down. What are some of the key things people should consider when deciding if LASIK is right for them?
Well, your age and overall eye health are really important. LASIK is usually for adults with stable vision, meaning their prescription hasn't changed much in the last couple of years.
So not for teenagers or people whose vision is still changing.
Right. And certain eye conditions, like if you have severe dry eye, glaucoma, or cataracts, those might make you not eligible for LASIK, or you might need to think about other things. It's like, gotta make sure you're healthy enough for the ride, you know? Safety first.
Makes sense. What about how bad someone's myopia is? Does that matter?
Definitely. LASIK can correct a pretty wide range of vision problems, but there are limits. If you have very high myopia, you might not get perfect 20/20 vision, or there could be a higher risk of complications. Your surgeon will look at your specific case and let you know what's safe and appropriate.
So it's not a one-size-fits-all solution, like we said before.
Nope, not at all. And remember those corneal characteristics we talked about? Those are also important for deciding if you're a good candidate.
Yeah.
A thinner cornea, or if it's irregularly shaped, you might be better off with PRK or SMILE instead. Right tool for the job.
Good point. So we've got eye health and the specifics of your vision. What about your lifestyle? Does that matter?
Absolutely. Your job and hobbies can influence the decision too. Like if you're a pro athlete or you work in a really dusty environment, your surgeon might suggest other procedures with a lower risk of problems.
So it's like choosing the right shoes. You wouldn't wear sandals to a construction site.
Yeah.
And what about expectations? It's got to be important to be realistic about what LASIK can and can't do, right?
You're exactly right. LASIK can really improve your vision, but it doesn't guarantee perfect 20/20 vision for everyone. Talk to your surgeon honestly about what you expect and what's possible.
So realistic goals and knowing the limitations are key. And let's be real. LASIK can be expensive. How should people think about that?
Yeah, it's not cheap. But think about the long-term savings. How much do you spend on glasses, contacts, solutions, eye exams, all that stuff over the years? LASIK often pays for itself in the long run.
It's an investment in your vision and quality of life.
Exactly. And don't forget about the psychological benefits. We talked about the confidence boost that comes with clearer vision. It can really change your life.
I bet. No more glasses or contacts. So many new possibilities. Feeling more comfortable and confident.
It really is. It's like a weight off your shoulders
Right.
in more ways than one.
This whole conversation has been so eye-opening. I feel like I really understand LASIK now. The good, the bad, and what to think about.
That's great to hear. Remember, knowledge is power. The more you know, the better choices you can make for your vision.
Absolutely. As we wrap up our deep dive, I want to leave you all with one final thought. If you could have perfect vision without glasses or contacts, what would you do differently? What new opportunities would open up for you? What dreams would you chase? Keep those possibilities in mind as you decide if LASIK is right for you. Thanks for joining us on the deep dive.
It was great being here. Keep exploring and keep learning.